Good evening, everyone. Welcome back another live session of Cancer Care at American Oncology Institute, Ludhiana. Today we have with us Dr. Nitish Garg, Assistant Professor, Medical Oncology, DMCH, AOI, Ludhiana. He has total 6 years of experience in the field of medical oncology and has been treating lung cancer since then, along with other malignancies. Today we will gather some information about lung cancer. Welcome, sir.
Thank you.
Sir, what are the risk factors of lung cancer?
So before coming to the risk factors, let me tell you something about lung cancer. So lung cancer is second most common malignancy in India in males. So because it is the second most malignancy and has a very high death rate. So coming to the risk factors, if we talk about, it is the most common risk factor is tobacco. It may be a smokeless tobacco or related to smoking. So smoking, it may be cigarette, bidi; smokeless, it may be khani, gutka, jarda, or in any other form. So tobacco becomes the most common risk factor, followed by a poor lifestyle and obesity. Obesity has been coming up as a second most common risk factor in most of the GI malignancies also.
Sir, what are the types of lung cancer?
So if we discuss about the types, there are two types of lung cancer. One is non-small cell lung cancer and other is small cell lung cancer. So small cell lung cancer is one of the most aggressive and a difficult to treat variety of lung cancer, whereas non-small cell lung cancer is relatively a better modality, relatively a better disease to have compared to a small cell lung cancer, because there are separate modalities of treatment where the responses can be good.
Okay, sir. Sir, what are the signs and symptoms of lung cancer?
So among the signs and symptoms, we usually see a patient of lung cancer presenting with cough, difficulty in breathing, blood in sputum, or along with that chest pain and chest heaviness. So these are the usual symptoms a patient presents with. So signs can be, there can be changes in the nails, what we label as clubbing. Then there can be swelling over the neck, which is the supraclavicular lymph nodal swelling, or there will be the facial puffiness and redness. So that may be related to superior vena cava obstruction.
Okay, sir. Sir, most common causes and things that cause lung cancer.
So we know the most common cause of lung cancer, I will say, in the present era is only smoking. So smoking, again, as I discussed, it is related to the tobacco. So tobacco may be the smoking part or the non-smoking tobacco. So that is the most common thing which is related to lung cancer. And yet we see few patients who are non-smokers also. So non-smokers, there may be some genetic factors or there may be some underlying mutations which are causing this disease.
Exactly. Sir, what are the common tests which are done to diagnose lung cancer?
So lung cancer is, first of all, a basic evaluation is done in the form of chest X-ray, which can show us that there is some change in the lung side or the thoracic cage. Maybe there is a fluid in the lung cavity or there are some opacities in the lung parenchyma. So then we go ahead to do a HRCT or a CECT chest, so which is contrast enhanced CT of the chest, which tells us that there are certain lymph nodes, there is a parenchymal disease, along with there is a pleural effusion. Pleural effusion is the fluid in the lung cavity. Then after that, what we do is a staging investigations. Once we do this investigation, that we go ahead with the staging, where we do a whole body PET scan to see what stage the disease fits into. But before going to a PET, I would like that we get a tissue diagnosis, which is done by putting a needle. So putting a needle into the lesion on the lung cavity. So we put the needle in the lung cavity and take a tissue from there that is labeled as a biopsy. So doing a biopsy gives us what is the histology. So it will define and tell us, is it a non-small cell lung cancer or is it a small cell lung cancer. Then we go ahead, do a whole body PET CT to see which stage it is fitting into. So depending upon the stage, the treatment is decided.
Okay, sir. Sir, how does a patient know about the stage of cancer?
So as I discussed, staging is basically dependent on symptoms first, second will be the investigations. So PET CT and the symptoms. So if a patient comes with the complaints of back pain and has already been diagnosed as a case of CA lung, so possible back pain is because of the disease has gone already into the bones of the back, so which is the vertebrae. Second will be bony pain, difficulty in walking. So that can again be related to bony involvement. Then there may be some other symptoms which may be memory loss, seizures, headache and vomiting. These may be related to presence of metastasis into the brain parenchyma, where the lung cancer, which some aggressive varieties like small cell lung cancer has very high tendency to go. So these are the commoner symptoms which can tell us that the patient might be fitting into this stage. So patient will come to know the stage based on the investigations. A doctor or an oncologist will come to know basically from initial blood workup and the symptoms. Definitely the staging is important so that the treatment plan what we are doing is exactly according to the international guidelines what we found.
Exactly. Sir, what are the treatment modalities of lung cancer?
So in treatment modality, we use a multi-modality treatment approach. So it contains chemotherapy, it contains radiotherapy, and along with that surgery. So early stage, if it is stage 1 or stage 1A, stage 1B or stage 2A, till that time we can go ahead with the surgery as a upfront modality. From stage 1B, 2B to 3A or 3B, the surgery may be kept as after initial chemotherapy to reduce the bulk of treatment. In stage 3, B and C, the only modality which we go for treatment is concurrent chemo and radiation, giving chemotherapy along with radiation, followed by something called immunotherapy. So just to touch upon immunotherapy, it is a drug which is given to the patient to increase the response of cancer by the increase in the response to the immune cells. So immune cells, this we'll edit. So the immunotherapy drugs increase the immunity of the body and cause the cancer cell killing. So this is how immunotherapy works. So immunotherapy in adjuvant setting, we give it for 1 year total. So in stage 4, if it is stage 4 disease, the treatment becomes based on chemotherapy, immunotherapy, or there are certain drugs which are called oral targeted therapies or tyrosine kinase inhibitors. These are the 3 modalities of treatment which are commonly used.
Excellent. Okay, sir, is the lung cancer curable?
Yes, lung cancer is curable if it is diagnosed early in stage 1, stage 2 and stage 3. So stage 3, we see the curability rates go up to 30 to 35%, but as we go to stage 4, the curability rates comes down. So stage 4 disease, it is not curable, but it can be controlled. And in case we are able to give a patient the oral tyrosine kinase inhibitors, the lifespan of the patient improves tremendously and the disease is controlled for a longer duration of time. But that happens in a smoker to the tune of 20%. In non-smokers, that may happen to the tune of 35 to 40%.
Yes, sir. Sir, can lung cancer be prevented? If yes, how?
So yes, lung cancer can be prevented. So basically, as I discussed, most common cause of lung cancer or the risk factor for lung cancer is tobacco. So once we cut down tobacco in our lifestyle, then the chances of lung cancer becomes like the normal general population. So tobacco consuming has to be limited. We should maintain a good lifestyle. Avoid eating unnecessary junk foods. Be healthy, reduce your weight if you're obese, maintain a healthy lifestyle, eating good food full of fiber and low fat and low carbs. So that will increase the chances of that the risk becomes like a normal general population, not a high risk. And another thing what is important is that in case a person is a smoker and has been smoking for more than 20 years, there can be some preventive strategy where we can do a low dose CT scan every 2 yearly to see if there is any development of a nodules in the lung parenchyma. So that is a screening tool to find out early stage lung cancer. Usually the lung cancer do not present in a early stage.
Ji. Sir, thank you so much for sharing information about lung cancer, and thank you viewers for watching our live session. If you have more queries, please reach out through Messenger or commenting below our video. Thank you.
Thank you.
Thank you.
Thanks.
So much.